We are going to start with this patient. It's a young patient, so you think, well, we cannot do, she don't need a lot, but she start to have some lines here on the neck. So I'm going to do a treatment for the neck with Profhilo. I'm going to show you how to do it. It's very easy to do, it's very nice. And then I'm going to show you the BAP technique, biostatic points technique, with Profhilo. I'm going to do it with a needle. So then you're going to see combination of face and neck. We prepare the patient, cleaning and disinfection of the skin. With Profhilo, we have in the box 29G needle and a 2 milliliter pre-filled syringe. So it's 1 milliliter per side of the face. And the biostatic points, they are designed to have a higher spreadability of the product and to avoid adverse events like intravascular injection. So the first point is more or less 2 centimeters in front of the tragus, a little bit in advance to avoid the artery that is going close by. We are superficial. The injection is intradermal or subdermal, so don't worry about adverse event. And we do a bolus there of 0.2 milliliters. The other point will be on the zygomatic arc. The other point will be on the zygomatic arc. More or less on this area. The third point will be on the mandibular angle. Here we have the angle of the mandibula, so more or less 2 centimeters in front. We're going to make the third point. The point number 4 has to be lateral to the nose. We know that the facial artery is going up this way, so we're going to be a little bit lateral. And the last point will be here. So we have 5 points. These points, as I told you from the beginning, has to be adapted to the patient. So you could have a patient with very bad skin, perioral. So you can inject Profhilo perioral as well. Or you can have a patient that has very bad skin on the forehead. So you can inject little bolus of Profhilo here as well. Okay? The technique I'm showing you now is the BAP technique, biostatic point technique. 5 points, 0.2 milliliter per point. Okay. So I'm going to prime the needle. Needle is 29G, as is already in the package. And there we go, slowly I inject the product. Okay. We go to the second point, and the same. Subdermal, look where I am, the depth I am, and slowly we inject the product. Third point, lateral to the nose, subdermal, and slowly we inject the product. Remember that it's not cross-linked, this product, so we'll integrate completely. Don't worry if you see little bolus. Sometimes you can have, normally if you have bruising, you can have a little fibrin net around it and can stay for a few days, but will completely disappear, integrated in the skin. The same, slowly, 0.2. I press for 1 second that the hole is closing there. You can see that I inject almost 1 milliliter, 0.2 to go from this side. I'm not using any sort of anesthesia whatsoever. And can you see it? Can you see it? And you can see a little bit lifting, slightly lifting effect compared this side from the other side. The patient normally is happy with this because they see something immediately, but it's because of the bolus we put there. You can see a little bit lifting effect. Okay. And I'm going to do the same on the other side. I try to don't go with rush. Try to do it slowly. Because it's less painful for the patient. Lateral nasal. So you see that's a treatment that's relatively quickly in your treatment room. So you don't need a lot of preparation or anything. And I press a little bit the bolus. I press a little bit. Do a little bit pressure. I don't massage. I only press a little bit. So the patient can immediately go back to their daily activities. It's not traumatic, it's not aggressive, it's not red, it's not nothing. It's good. Okay, let's gonna see the neck. The neck I prefer to do it with cannula. I don't know how you normally do it here. So I'm gonna make a little hole to go with the cannula in. So I'm using soft fill cannula. So I'm slowly dissecting, and I'm going to start to introduce the product slowly with fanning technique. With the cannula you are safe, you're not going to harm any vascular structure, and the neck is moving a lot during all day. So I'm doing retrograde slowly. You can see that I'm superficial with the cannula. And we almost finish on this side. I'm going to press a little bit to turn, to help to turn the cannula. Very good. We are finished, 1 milliliter. I'm going to do little injections with a small bolus. The patient don't need to bleed, so you have to be quite superficial. You can see the little boluses. You can also use this technique on the décolleté area. It's a little bit more painful if you do so many injections, so you could use a little bit of EMLA cream before to prepare, but it's not a complex technique at all. And if you are not familiar with cannula, it's also safe. And the product will spread on the area. Then after 1 month, will be recommended the second treatment. So here you can see little papulas on this area, but will integrate normally 24-48 hours. You don't need any specific extra care for that.